I rise today to offer my strong support for the Lowy Amendment, which would restore nearly $318 million in Title X. And I rise to vehemently oppose the continuing resolution which completely eliminates Title X funding. Title X funding provides low-income women with access to contraceptive services, but it also provides coverage for primary care services, prevention services, including screenings for breast and cervical cancer, STD and HIV testing, screenings for high blood pressure, diabetes, anemia, pregnancy testing, health education, and referral for other services. It has nothing to do with abortion. Title X, of course, prohibits recipients to not expend these monies for abortions. Madam Chair, I find this CR particularly troubling because I know that the overwhelming majority of Title X patients are very, very poor. In fact, 70% of these patients have incomes at or below the federal poverty level, meaning that they earn less than $10,830 a year. 92% have incomes at or below 250% of the federal poverty level, meaning that they have less than $27,075 a year. Now, you know what? We begrudge these patients temporary assistance in needy families so that if they would become pregnant and have an unintended pregnancy, we would call them welfare queens and begrudge them welfare benefits. And these patients who are disproportionately poor, women of color, would not be able to receive the economic support they need. And with this cruel continuing resolution, would not be able to receive the primary care that they deserve and that they need. We talk about the need to have jobs in this tough economic time. How can women who have no family planning dollars sustain a job and get a job when there are unplanned pregnancies? As a co-chair of the Women's Congressional Caucus, I want to take a final moment to note that access to family planning services has been nothing short of revolutionary for women in the United States. Women's ability to control their own reproductive destiny has changed the landscape at home, at work, and in the community. It's fundamentally altered women's role in society, and researchers tell us that it's helped to decrease infant mortality, child mortality, and maternal deaths. These are all incredibly worthy goals, both for women, men, and families. We have heard the cry of those who want our country back. We've heard the cries of those who want limited government. We have heard the cries of those who want to cut spending. Well, I say we want our bodies back. We want to govern our destinies. And we want to cut suspending our choices. And so therefore, I urge all of you to join me in supporting Congresswoman Nita Lowey's amendment to restore Title X funding.